The Territory government's agreed to increase the number of international arrivals Howard Springs will take per fortnight from 600 to 850 because other states don't want them.
Around the country, they're looking to reduce the numbers they're getting into their quarantine systems. That's simply a precaution.
All states are worried about COVID-positive cases moving from hotel quarantine to hospital. By contrast, in Howard Springs, the federal government is caring for 20 positive cases on site.
Essentially, the nation's taking a bit of a deep breath around international arrivals in, capacity in hotel quarantine, and making sure there is no flow-on impact onto our hospital system.
It's increasing pressure on staff trying to manage the availability of rooms, kitchens and other facilities at the centre between the needs of international and domestic arrivals.
Before we agreed to 850, obviously we made sure those places were available.
The international section would need more federal AUSMAT staff to take any more people.
We've basically reached the limit probably of what we can handle at Centre for National Resilience with the skilled staff that we have in the Territory.
While people in the domestic and more risky international areas of Howard Springs are kept totally separate now, the NT government's cyclone plan is that they should all share the same shelter in the centre and be spaced apart from each other.
I don't think it'd be correct to say we've got two cyclone shelters. We've got one cyclone shelter. It's more about how you manage internally within that cyclone shelter.
There were more than 1,300 people in the domestic and international sides of Howard Springs at the weekend. Pressure has now been reduced by the NT government's removal of its Brisbane hotspot.
Since the direction of the Chief Health Officer has been amended for the greater Brisbane area, 352 people are commencing exiting from that facility.
Interstate arrivals from Brisbane and Sydney, still considered a risk, are continuing to get tested. The government says many spent several hours waiting on hold to book because a technical glitch broke the callback system.
And I've got to apologise for people who tried to make an appointment for a test and waited on the telephone.
In response to Tiwi Islanders' calls for everyone to have a negative COVID test before visiting, the Chief Health Officer is sympathetic but made no specific recommendation.
I think all controls are necessary.
The government says COVID vaccinations for people most at risk will start in the NT next month, while the rest of the community will wait until the second half of the year. Jane Bardon, ABC News.